A silent revolution is happening in healthcare, and functional medicine is at the center of it. The shocking truth: 75% of healthcare costs in the US are due to chronic conditions. Many of those conditions are preventable with the right counseling and lifestyle interventions. Sadly, though, traditional medicine doesn't have the time nor attention to focus on these areas, but functional medicine does. Let's talk about the major differences between functional medicine and traditional medicine. First, think of your health like an iceberg. Traditional medicine often treats what's visible above the surface, your symptoms, the final manifestations of disease. But that's just the tip of the iceberg. There's so much more below the surface. Functional medicine digs deep to find the underlying issues causing those tip of the iceberg conditions. And in functional medicine, we're trying to catch things early before they develop into outright disease. It's all about the approach, and I'm going to break it down for you. So the next difference between traditional medicine and functional medicine is what versus why. Traditional medicine asks what you have. They need to put you in a diagnosis box before they can help you. The insurance companies require a diagnosis even for them to be paid. Functional medicine asks why. Why are you experiencing these symptoms, and what is the root cause of it? Patients are more savvy these days. They don't want to walk out of a 10-minute doctor's visit with a prescription and no understanding of the underlying cause and no discussion about alternative solutions. They want to know why. The third major difference between traditional medicine and functional medicine is normal versus optimal. Let's take thyroid, for example. You go to your doctor's office and you say, "Doc, I'm tired, gaining weight, I feel cold all the time, I'm constipated, my hair is thinning." These are all symptoms related to an underfunctioning thyroid. You convince them to check your labs, and typically they're only testing 2 to 3 labs related to your thyroid when they should check about 8 or 9. You get that dreaded voicemail from the nurse: your labs are normal, but you don't feel anywhere near normal. So you go back to your doctor's office trying to advocate for yourself, and you say, "But I'm still having all of these symptoms." And then the doc says, "Well, your thyroid labs are normal, so it can't be that. Maybe you're depressed." So now you walk out with an antidepressant. I've seen this over and over again with patients who finally find me after years of frustration. Once we get a full thyroid panel, we see there are some labs that may be normal, but they certainly are not optimal. How would you rather feel? Normal or optimal? Now, in functional medicine, we don't give diagnoses that are not valid. I want to be clear there, but we're not focused on the diagnosis. You can get your thyroid optimized without prescriptions and without having to label it. That's just one example, and I could go on and on. The final major difference that I'll share today between traditional versus functional medicine is the time you spend with your doctor. Traditional doctors spend about 15 minutes with their patients, while functional medicine docs can offer hour-long visits. I personally spend 90 minutes with each new patient. That's like skimming the back cover of a book versus reading the whole novel. You're going to have a deeper understanding just by spending more time. And this is not a traditional medicine bashing session. I'm merely pointing out the differences. They are confined to the system they're in. They are forced into seeing lots of patients, and they don't have enough time to spend with each one, and they'll tell you that themselves. On the other hand, because most functional doctors do not participate in insurance, they are outside of those time and diagnosis constraints. Functional medicine docs can spend the time necessary with each patient, focusing on the why and not the what. Working toward getting patients to optimal, not just normal. It's about treating the whole person, not just isolated symptoms or diseases. This approach is comprehensive and science-based, looking at how your genetics, your environment, and your lifestyle impact your health. Instead of just managing symptoms with medications, functional medicine addresses the root cause issues in your body. It's like getting up under the sink and actually fixing the leak in the faucet instead of just mopping up the water. Imagine spending an hour with your doctor, not just focused on treating symptoms, but uncovering why they exist. What would change about your health if someone finally asked why instead of just what?